Thank you very much, Chris, for your very kind introduction. My name is Ana Diaz. I work at Alzheimer Europe as project officer, and it's an honor to be here today, and a great pleasure to have Jayne with me. Jayne has very kindly come with us in this presentation. Jayne is very many things, but she is a supporter and the wife of Chris Roberts, who is the vice chair of the vice chair of the European Working Group of People Living with Dementia. Yes. So I think this morning we have here already a lot about the importance and the attention that is being given to real-world evidence, and Chris was already providing a definition at the beginning of the session. And as we hear this morning and again, this is a very important and interesting concept. However, using real-world evidence raises ethical, legal, and social issues. And also the secondary use of data can also raise some concerns among the general public. So with this in mind, very early on the project, RadMap wanted to have a very extensive stakeholder engagement into this area to ensure the patient interests and concerns were accounted for in an LC framework for real-world evidence platform for Alzheimer's disease. And in that context is where Work Package 8, the work package we are presented from today, carried out a literature review about the attitudes of patients and the public into the secondary use of data. And on top of that, we also conducted 2 focus groups with people with dementia and their supporters. And it's in this second area where the presentation, where I'm going to focus on the presentation of today. So I'm going to try to give you a bit of an overview about the approach and some of the key issues from the focus groups that we conducted with people with dementia and their supporters to understand patient and care attitudes towards ethical, legal, and social implications of a real-world data platform for Alzheimer's disease. And I will now introduce you to the European Working Group of People with Dementia. Some of you might have already been in the symposium, in the special symposium, where all of them were present. This is a working group that's Alzheimer Europe set up back in 2012. The group is composed entirely by people with dementia, different times, different forms of dementia, and different stages of the condition from different countries across Europe. Over the last term, 2016-2018, the group has had in total 12 members. The group was set up at the time in 2012 to ensure that Alzheimer Europe activities and projects duly reflect the priorities and views of people living with dementia. The group meets face-to-face 3 to 4 times a year. One of these is here at the time of our annual conference, and the other 3 typically are in Brussels or in Luxembourg. And when we met with the group, we addressed with them various issues, and very often they have been involved in many European and IMI projects, and they are providing feedback and input about various issues that are of interest for that particular project. So I wanted to talk today a little bit of the methodology, the approach we use, in particular within this work for RadMap. The focus groups were conducted during one of the regular meetings of the group, and that was back in 2017 in December in Brussels. We invited all the members who attended the meeting to be part of the focus group discussions. And although normally the members of the group are only the person living with the condition, living with dementia, and the support typically is there only to provide support to the person during for coming to Brussels or during the event. In that particular time, we also asked the supporters to attend the meeting and participate in their own right. So they were, in that particular occasion, they were talking about as a care of a person with dementia, as opposed to just providing support to the person. And this piece of research was actually granted ethical approval by the University of Oxford Social Science and Humanities Interdivisional Research Ethics Committee. The members of the group were, in fact, already familiar with this concept because they had been involved in a few pieces of work with RadMap. So they had been involved previously in June in another part of RadMap work in relation to the outcomes definition. So they knew a little bit already about what Roadmaster is about and real-world data. Still, as we always do, we send in advance, 2 weeks in advance, accessible information again about what the break is about, real-world data, and in particular in that case, also some information about the issues that will be discussed with them in the meeting, as they were particularly difficult. Sometimes talking about ethics is not the most easy topic to address for many people. We also sent to them information sheets and consent form. And each member of the group was free and able to decide not to participate, but actually, in fact, all of them were very happy, and I think they very much enjoy being part of these discussions. We had a half-a-day session with them, and we started the session with Andrew was there from the University of Oxford, and he was very kind and presented again everything that they had received. So they had the opportunity again to listen and ask questions about different areas that could be difficult for them to understand. And before starting about the different questions, we had a brainstorming session and exercise, and we kind of started the session asking them openly what their were understandings of health data and data sharing. And it was a very productive session and quite eye-opening about the different things that they had in mind about these two, and quite broad. And then after that session, we split the group into subgroups. One was of people with dementia and another just with the carers. That was the session of one person who needs support from her daughter. And the group of people with dementia was facilitated by 2 Alzheimer Europe staff members. One of them was myself, and then my colleague Diane Gove. And the second group was facilitated by Andrew and Sebastian Lever from Alzheimer Europe. And in total, we had 11 people in the group of people with dementia and 10 carers in the other group. We used, as I was explaining to you, we thought real-world data can be a quite difficult concept to understand and to have an opinion about. And if you add to that also ethical issues, that brings a lot of complexity. So we decided to use vignettes, which we have used in the past. We think that can help people to have hypothetical scenarios, and that might help them to relate to some of the issues to be discussed. It's a first approach for them to come from opinions. And then just to give you an idea of the areas we debated about, we asked them about what kind of data should be used for research, who the data should be shared with, and what measures should be in place to make sure sharing data is acceptable. As we have here one of the people who was involved, it's a pleasure to have Jane here. I would like her to say a few words about her experience firsthand of being a participant in one of these focus groups. Jane, first.
Well, first of all, it's not always easy to be involved in research, because when we first heard about research, we thought it would be taking pieces of Chris's brain, you know, all sorts of invasive research. And it's lovely that being involved with the Alzheimer's European Working Group, we found that actually research can be things like filling forms in, it can be all sorts of qualitative as well as quantitative. But the beautiful thing with Alzheimer's Europe is that they do actually give us a huge amount of support, not just for the person with dementia, but us as well, because we are as blank as the next person as to what big data is. I don't know what data is, but I've since found out. So we receive all the information beforehand, it gives us a chance to look through it, it gives our person with dementia a chance to actually look through it and try and digest some of it. They say, well, you know, Chris, my husband, may not necessarily be able to retain the information, but then there's no saying that I can either. But it's very important that we go into these things with a little bit of a foundation, not going into it blind. And then, as you heard, we had half a day to tell us actually what it's all about, what it means. Because by giving us that information, we are then able to input more of the research that you want. We're able to participate far more fully because we understand exactly what it is that you're asking us for. And then when we were set into different groups, that was quite good, because very often it can be all about the person with dementia, and then as a carer you don't know whether you should be participating or not, should I say, shouldn't I? And Alzheimer's European Working Group are very clear that when it's time for the person with dementia to have input, and then when we have input. And the brilliant thing with this study is some of the questions it raised, I hadn't a clue about where data comes from. And one member of the carers group actually said that she doesn't use debit cards. And I said, don't be silly, you can't go through the 21st century without a debit card. And she doesn't use them, she said, because they can get your data. So as well as all the research going back to the researchers, we actually learned so much more about real-world evidence, what is out there, how our information is collected. And it's very important that we have trust in the people that we're working with. Now, we go in there with blind trust because we know if Alzheimer's Europe are introducing us to them, then they've done their due diligence, and they will not bring somebody in that is not going to facilitate the way we might like it, but that actually if Alzheimer's Europe trusts them, then we trust them. And we also know that Alzheimer's Europe will have given them evidence or information to actually conduct the sessions in a very inclusive way, to include everybody's voice, first with dementia, my voice, but everybody around the table. And that gives us a great deal of confidence that the work that we're being involved with, the research that we're inputting to, is going to be actually collected in a very robust manner, and the evidence will be interrogated intensively.
Thank you, Jayne. Now you hear a little bit about what happened on the day. I actually wanted you to get a bit of a background about what happened afterwards, what we did with all of that. So the focus group were audio recorded and then fully transcribed. And we had a lot of thinking about anonymity, and this is something that sometimes members of the working group, they don't mind about not being anonymized, but it's a principle for us. So we had a lot of thinking also what we do, because it's only 11 members from different countries, so they're very easy ways to identify who is whom. So we tried, first of all, to have replace the participant names with pseudonyms. That was easy enough. And then also try to also not to have the country they were coming from, because then you could identify easily the person. So we had reference to the participant's home country was disguised as Northern, Eastern, rather than the actual country, and all references to particular languages were also anonymized. The transcript were then analyzed thematically. We used a thematic analysis approach. And we had all the different people involved in facilitating the data, and also Alex were looking at the different themes that were emerging. And we coded independently, and also the group from the people with dementia and the group from the carers separately. And then we came together and we tried to look at what were the main issues that we all kind of agree were emerging for the different discussions. And we had several issues and several important themes. And because we only have a very short time today, I'm only going to focus on two of the actual very important issues that were of great importance for both of the groups. And also, these two topics are also important for the next step of the process. First one is about trust. And I think Jayne was already talking about trust. That was a very, very important topic. And they were thinking about trust also as a blind thing. They were kind of having their faith fully into the research, not because they didn't understand the complexities and the risks, but they kind of thought they need the trust in order to science to progress. So this is one of the discussion in the group with the people with dementia, and they were saying, I know there is obvious reasons not to trust the system, but I have to. When we sit here talking, I have to believe that the system is operating correctly. Otherwise, there wouldn't be any discussion at all around these tables. And the facilitator was, so you have to be in faith. You have to have the faith in the system. There's a lot to trust involved, and everybody agreed with that. So there was a very important topic around trusting and understanding, understanding everything that was considered when they were sharing the data, when all these systems are in place, but at the same time, the need to believe and the need to think that in order to progress, we needed to actually trust and be able to share this data. And there was a second very, very important topic that we're also discussing both groups, and that was that there should be a greater engagement of people living with dementia and their carers in any research that would be undertaken. And that, in fact, for them, was a way to enable participants to deal better with uncertainties about risk of sharing the data. So there was very much interconnected. And here you have another quote from, in that case, one of the supporters. You see, you gave your permission, you were involved, and they haven't had any courtesy to say, look, this is what we have produced, so it's a very bad form. So somehow they wanted to have a much bigger engagement with research in general, and to have more feedback, and to understand how what they were providing was being used, and to have a much greater involvement in that way. And that will help also to address the risk and the uncertainty that was obviously part of these discussions. And I wanted to bring that to particular topics also, because what was interesting for this piece of research is that it's a very interesting piece of research on its own, but also what I think is for Alzheimer Europe very important, this is part of a larger patient strategy engagement, where it's beyond just understanding better their concerns. It's actually having the opportunity for the voices and concerns of people with dementia to have an impact on the project. And that's where I think it's a different. We are able to influence what's happening on the project. And these are some examples of how the discussions on the focus groups were then recommendations for the actual project about how to deal with certain topics. And we're able to have a number of recommendations for the project itself, which are beyond the scope of the actual focus groups. And also to let you know that we then have also, as part of the patient engagement process, we had also another session later on with the people with dementia. We presented to them the main themes that we thought were emerging for the data, so they were also involved in the interpretation of the data, and they had the opportunity again to see how what we think was important for that discussion were actually important for them. The working group actually additionally will have the opportunity to provide feedback and comments on any subsequent publication. So it's not just about this one piece of research, it's about having them involved and part of the project. And the findings from the focus group will be integrated into an ethical framework that will be guide the data integration practice in RADMAP and provide recommendations for a European-wide real-world evidence platform for Alzheimer Europe. So that's for us where is this interest is in having that kind of connections. Just for you to know too that the findings from these discussions have been submitted for publication, so hopefully will be published soon, and you will have access to the whole all the findings of the project. I just wanted to end with another asking Jane to please have your wrap up about your recommendations or take-home messages for the researchers, and what do you think is important to involve people with dementia and supporters in this way?
It's absolutely vital, as we've heard several times today in the plenary and in the parallel sessions. If you don't hear us, if you don't include us and hear our voice, you will not have such rich evidence in your research. We need to be involved as co-researchers from the very beginning. As one of the questions that was asked in the symposium earlier, what is it that you want us to ask? Well, ask us and we will tell you. We will come along and we will tell you. And then your research is not only relevant to the academic groups, but it's relevant to the real people out there that you're doing the research for. Because we need this research, but we also need to be involved so that you get it right, to get it right for us. The key messages to take home is when you're having participation, or whether it's a participant in the research or whether it's a PPI involvement, then we need to build relationships. You need to build trust. And the trust that we have in Alzheimer's Europe is it's absolute, because we know that they're going to do the due diligence. They won't put us into a position where we can be taken advantage of or left feeling undermined, undervalued. But that relationship building, and it starts from the very beginning. Be prepared. Give us the chance to have that preparation beforehand. Let us know what it is that you're asking of us, because then we can give you more. And one of the things, when we were separated into groups, very often the carer can be quite protective of their person with dementia, depending on who they are in the relationship. And we were separated, but we were separated in the same room, which doesn't always work brilliantly because of the noise levels. But then any carers that may have been a little bit more concerned to be separated, actually you're still in the same room and it's fine. But one of the fantastic things that came out of this, which is nothing to do with roadmap, but it's how, if you want to learn how to involve people, speak to Alzheimer's Europe, because there was a participant whose English was not very strong. But there was another, in the people with dementia, there was another participant who lived in the country next door, and the carer was able to come and join in into the carers group, and these two actually supported each other, making us obsolete for that particular session, which was absolutely fantastic, because then they have built up a relationship between themselves, which is nothing to do with roadmap, but it's all about building trust and relationships. Give us the information so that we can give you the evidence that you need. I think that's all.